Okay, so we're getting ready to get started right now. So let me get my first slide up here for everybody so you can see it. Thank you once again for joining us. We're going to go ahead and get started. So we've formatted this presentation today. Actually, it's more of a conversation to make this a little bit different and give you an opportunity to ask some questions if you would like while you have Tony and me on the phone. So let's go ahead and get started. Thanks everybody for logging on. This is Gary Paquin, one of the co-founders of iRemedy Healthcare, and I've got with me my brother Tony. Tony's joining us and will be commenting on any of the questions that you have as we go through today's short meeting, scheduled for about 20 minutes, 20 to 30 minutes, depends upon how many questions we have. If you have any questions, if you open up the GoToMeeting panel, which has the little orange arrow, then you can go down to the area that says questions, pretty small type, apologize for that. Click on that and you'll be able to submit a question and that'll come up on my screen. So I can see that, I'll bring that up and then we can cover that with Tony. So let's go ahead and get started just by way of introduction. So once again, thank you for joining us. Just as an introduction, iRemedy is an AI-driven technology that is designed to revolutionize the $130 billion medical supply industry. And as we'll talk about in this presentation, not a lot has been done in this industry for the last, number of generations, literally. And as we all witnessed over the last couple of years, particularly with the pandemic, is that when the medical supply chain is broken, there's problems. So we had problems getting medical supplies to the people that need them. Patients suffered, and literally we had excess fatalities as a result. Now, iRemedy solves that problem by creating the world's largest online market procurement marketplace powered by this AI technology that we're going to be discussing. So we take the process of sourcing these life-saving supplies out of the hands of the old systems and use new technologies to identify those supplies. So Tony, if you could just make any opening comments you'd like and say good afternoon to our session.
Absolutely. Good afternoon, everybody. Again, I see we have another really large group of people online. We appreciate that very much. We're always super excited to talk to both current and prospective shareholders, and I think we have both on the call today. As Gary said, we're going to do this a little bit different because we want to be a little bit more conversational. We are tending to get a lot of questions, and sometimes we run out of time at the end of the presentation because the other side is we try and keep this, reasonably short and convenient for everybody. But again, happy to talk to everybody. Super excited to have that conversation. We're having just great success at iRemedy and feel very good about the future.
And just to kind of kick it off a little bit, and I thought, there's a couple of interesting discussion points because these are the things that Tony and I have lived for the last 25 or 30 years because we've actually been in healthcare technology since the late 90s. And as we all see, and I think it's something that we all agree upon, that healthcare is very personal, right? It impacts every one of us, our families, the cost that we have to deal with, and so forth. And so one could be very pessimistic, about the cost of healthcare and what's going on, and then one could be optimistic based upon all the new discoveries that are taking place. So, here's an interesting question, Tony, and you and I have talked a lot about this. And in your words, what do you think is wrong with healthcare in America today?
Yeah, well, there's an hour-long conversation right there.
Right. Yeah.
First off, I fall into the camp that I'm an optimist about the future of healthcare because, in fact, there's a lot of just tremendous inventions taking place. We've talked about this for a number of years. So new drugs, new cancer treatments, new interventions, new surgeries, all that, new research being done. There's just a lot of, great breakthroughs happening right now. So that's it's a good time to be alive, as they say. That's very good. in healthcare in America today, though, at the same time, there's challenges. We're a big old country, 300 million people, very different, lots of economic issues. So really, at the end of the day, the problem with healthcare is it's very expensive in the United States, everywhere around the world. But you've got all these leading technologies. They cost a lot of money, drugs and devices and so forth. It's highly regulated. And then the other thing is it's constrained by just old rules and regulations, systems and infrastructures and establishments that have been around for decades, and in many cases, 100 years or more. And then finally, what I would say the biggest problem in healthcare today is the impact on healthcare caused by globalization. So, like we see every day now, and we talk about it over the last couple of years like we never have in the past. But, like everything else, healthcare moved overseas. So sure, you still go down to your local doctor, your local hospital, but that MRI machine and that X-ray machine and that medical device and that drug that they're giving you and those gloves that they put on their hands and, so on and so forth, that needle that they inject you with and that saline bag, well, pretty much all of that comes from somewhere other than the continental United States. And most of it, in fact, comes from China or other Asian countries, but certainly all around the world. And this globalization thing is just causing all kinds of problems. And it's going to be, that's the problem we're going to face more than anything else. You may not realize it, but that's the big problem today.
Yeah, I agree. We had, it's interesting because over the last 20, 30, 40 years, this America started moving a lot of its manufacturing and sourcing of medical supplies to Asia, for the obvious reasons, because these companies are looking for more margin in their products. And we as Americans didn't notice that, right? We just kind of went along and everything seemed to be fine. Well, it worked until it didn't work. And then the pandemic occurred, shortages occurred, the supply chain broke. It's kind of like, well, hold it, we've got to get products from Asia, as Tony said, primarily China, get them over here to this country. So those problems manifested in a very, very bad way over the last couple of years. And so we became aware, if you will, that the patient is sick. And when I look at, what's wrong with healthcare in America today, there's a lot of things. One is accessibility to a certain degree, particularly for people who live in rural areas. And it's hard for rural healthcare systems to be competitive using old technologies. A little bit of the fear of the unknown. Like many Americans, I go through my regular set of, I've got to get this done, got to get that done. And I don't know what to expect, particularly from a cost standpoint. Is this going to cost me $100? It's going to cost me $10,000, even though I have insurance. So expense, not only at the macro level, but down to the micro level, down to my very personal level and that of my family. It's something that, we think about all the time. And as Tony said, shortages. And shortages is what's going to continue to exacerbate all of those problems. Accessibility and shortages and everything else are going to be worse in the future. And so here's an interesting, just conversation to have. And, Tony and I have been immersed in this for, as I said, going on 3 decades now. Why are healthcare costs in America more than double versus other, similar countries? Troy, what would your answer to that be?
Yeah, well, in some ways, that's a political question, which we try and avoid. Gary and I having different political views of the world sometimes.
Yeah.
But, it is, first off, you go back to, this globalization of supply. Supplies are very expensive. Drugs are very expensive. And there's all these layers of distribution involved. So, you get some, small item in healthcare that might cost $1 to manufacture, and it might sell for $100 by the time it gets through the system.
Exactly.
So there's that. It's just the high cost of products is a very big part of it. Now others, you could get into, insurance and, the private aspect of healthcare in the United States. And the other, there's arguments about drugs that are developed here and patented here. And then, the generic versions are more available offshore. There's just some of these, very unique global facts about the way healthcare is managed. But the bottom line is we just have an old system here in this country that we've just built upon. Sometimes there's advantages in other, up and coming countries, if you will, because they can put in the most modern technologies.
Exactly.
I remember I was talking to a hospital about gloves, just take gloves as an example. And they use, hundreds of millions of gloves. I mean, these, you figure every employee's changed them 3 or 4 times a day, right? So they go through a lot of gloves. And, those gloves aren't made in the United States. They haven't been for, I don't know, 20 years. They're made all over the world, but mostly in Asia. And when you envision, I talked to this procurement vice president about this, and I said, these gloves you're using, they're probably made in Vietnam. And he's envisioning like some old, hut in Vietnam that's making gloves. And, that's not the case. That glove manufacturing in Vietnam is $1 billion high-tech, highly sophisticated business. I think some people really misunderstand that these, what used to be third world countries, have come along and they've implemented the most modern version of what was available. It's like they talk about countries that didn't have telephones didn't put in copper wire. When they got telephones, they put in cell phone towers, and they went straight to digital cell phones. And the same is true with healthcare. You can go around the world and you can see these very modern healthcare systems because they're brand new and they were built with the ubiquitous offering to everybody and the most modern technologies and the most modern systems. Well, in the United States, it was all invented here, and in many ways, it's still run much like it was 30 years ago, 40 years ago, and because it's hard to take everything, just throw it away and start over. Hard, it's impossible. You can't do that. So you have to incrementally make change and improve, and improve your processes. And we're very passionate about product because that's where we've spent the last couple of years very focused. And product is very, very expensive here. Manufactured overseas, but by the time it gets here, it costs a lot more than it should.
Exactly. And I think one of the things that we all agree upon is U.S. healthcare system is highly bureaucratic. It's a little Byzantine at times, if you will. It's kind of like we paved the cow paths over the last 100 years. So it's a highly legislated industry. It's a highly litigated industry, by the way, that adds cost to healthcare and so forth. So, there's a lot of factors, but one of them that we're very focused on has been the lack of utilization of technology and efficiency to begin to address those costs and drive those costs down. So in many cases, when you look around healthcare, we're operating as if it's 1950. And so we wanted to bring it forward literally 3/4 of a century. And Tony, I know you've been kind of at the forefront of this. How is AI going to change the cost structure? Because I know it's not just supplies, but AI in general. What are your thoughts on AI in healthcare?
The best way I can describe it is years ago when Jim and I began discussing iRemedy and how we were going to solve the medical supply problem. Jim, by the way, we'll talk about, but former vice president of technology at Amazon, just a brilliant inventor, now our chief technology officer. Well, this was just a couple of years ago, and we said, AI now is getting to the point where it's powerful enough to solve these complex problems. And that's really what it comes down to is, we're in it. We have a very complex catalog, supply chain, pricing, availability problem. It's sort of like a million squared. We have like 1 billion data points. It's just very difficult to manage. But now with modern AI technology, we can do that. And what you're just beginning to see now is AI like ChatGPT moving into other areas of healthcare. I've read some articles, about, the way it can diagnose disease and so forth. And they'll be very careful as they qualify that and get it out into the marketplace. But the nature of healthcare is it's very complicated. And the power of AI helps you manage that complication.
That's exactly right. And AI, certainly when you get into the world of medical supplies, it's really got a great application because the world, as we'll get into it in just a moment, when you look at the world of medical supplies, it's highly complicated. You've got millions of products and millions of price points, so forth. It's literally have billions of pieces of data points, if you will. So it's impossible for people or even computers up until this time to be able to deal with all of that. So using AI now, you're able to leverage machine learning and be able to then perform the functions of 10 people, 100 people, or 10,000 people. And so that's going to have a really big impact. So here's kind of just an out of the blue, what does healthcare look like to the average American in 10 years or 20 years, Tony?
Well, much better, because of the inventions and the AI and the power
I
of
agree.
computers. But, drugs, devices, and knowledge about nutrition and exercise, improvements to the environment. Life expectancy will continue to increase, but quality of life will go up. That's what I talked about. It's a very optimistic time. And, we'll continue to see that for 10, 20, 30 years. As long as, we continue the investments in healthcare, it's going to get better. As it gets better, it will become more affordable. As it becomes more affordable, affordability is really about access.
Right.
So you have insurance, I have insurance. We can complain about the high cost of healthcare, but we don't really pay for it. We have insurance. And so for us, it's not an accessibility problem. For people who don't have the right insurance, or they have, they're not employed, or, there's other problems, for them, it's an access problem. And that's what's really key. So as costs come down, accessibility will go up.
And I think I think AI and other factors are going to impact it too, because it's going to improve accessibility. It's going to drive down costs. Things like telehealth, as an example, suddenly started coming into play over the last couple of years. I know for most everybody, you can kind of think of healthcare pre-pandemic and post-pandemic. Tony and I were laughing about the other day as we go in to see our doctor on our annual wellness visits. It's rare we see the doctor anymore. Now it's a nurse practitioner and so forth. So it's really changed. So as I said, submit questions to the GoToMeeting panel as they pop into your head at the end of this another 10 minutes or so. We'll handle those questions. But to begin with, want to give you just an introduction to iRemedy, what we're doing, what our mission is, and the leadership team. Our leadership team, I think, is the best and the brightest in the world of healthcare, combined with the best in technology. And when you put those two together, we can do some truly innovative things. My brother Tony is the CEO of the company, and Tony is a lifelong technologist that I've worked with, and a brilliant technologist at that. He's done a lot of different things in his career. He's the founder and CEO of Agency One. That was an insurance software company. We sold that to AMS, which is to a company called AMS, part of CNA, and was a consortium of insurance companies, and we grew that to be the largest software company in the insurance industry. Tony's authored one book completed on healthcare and another one being completed as we speak. So that will be published this summer. And also, Tony is the founder and CEO of Metanex, and we had an IPO on the NASDAQ. Jim Harding is our CTO. Jim is the former VP of technology at Amazon. Literally, he's the guy that built and launched the Amazon marketplace. When he joined Bezos, they were an online bookstore. Bezos said, I want to do something radically different. I want to build this marketplace to sell millions of products to hundreds of millions of people. Jim said, well, we have to invent a technology to do that. He did that. He actually has a patent for that. Prior to that, Jim started 2 different technology companies. He sold both of them to Amazon. That's how he got to know Bezos over the years. He was the founder and CTO of Multiscale Health Networks. That was a healthcare technology company. That's where we met Jim, working with a group of hospitals on the West Coast. And Jim, right out of college, was one of the founders of Seattle Computer Products. And that was a group of young guys that they were the creators of PC-DOS. And they licensed that to Microsoft. And then Jim went on as special advisor to Microsoft. Actually has a patent with Paul Allen. So, Tony, talk to us a little bit about big picture, the healthcare supplies market.
Well, we target a segment of that market that's about $100 billion, and that would be medical supplies for hospitals, government agencies. We're very focused on surgery centers, and we also provide products to doctors and dental offices and consumers. So we can cover that, that range of users. The government is still, is a very big user of medical supplies because you've got the VA, and they provide the healthcare for about 40 million Americans. And there's other things the government does, strategic national stockpile and other initiatives, designed to take care of future pandemics, if you will. The industry has really suffered from a lack of price fairness, is the simplest way to say it. I always just say, if you put 100 doctors in a room and you ask them what they all pay for the same scalpel that they all use, let's say 100 surgeons, you might get 100 different answers. I mean, it's just an unfair system. It's like people flying on airlines. Everybody pays a different price for the same seat. They're going from the same place to the same destination, but they pay a different price. And it's like that in healthcare. Everybody pays a different price. It's unfair. And that tells you that there's too much margin, too much profit being worked through the system. There's just problems with data accuracies, and then really shortages in the supply chain. So, we saw this in the pandemic, and everybody's hyper aware of it, but it's been going on for 30 or 40 years. In healthcare. It's just common, to the point where the FDA maintains a list of drugs that are currently under shortage. I mean, it's routine, and it shouldn't be. That's ridiculous. And it has to do with going back to the catalog, the complexity, and the globalization. It's also very expensive. That's because of the multiple layers of the healthcare system. You've got manufacturers, exporters, importers, distributors, dealers, logistics companies. You have a lot of people taking a bite out of that apple before it gets from the manufacturer in China to the patient in Chicago.
Exactly, and that leads to the high markups. To Tony's point, prices just all over the place. We'll have to tell you, it's just chaos. So I think this slide covers it well.
This just summarizes it. What you have are hidden costs that really, when you add it up, makes it very expensive. You have this global supply chain that is unreliable and breaks often. And that all just creates a very negative customer experience.
And the key is, it doesn't have to be this way. So that's what we do that's different. So Tony, talk to us a little bit about our AI-powered supply chain that iRemedy uses.
Yeah, so what you have to do, and the one way to think of it is, you got this big old complex supply chain, and you gotta make it smart. And we talk about smarter supply saves lives. So what our goal, our mission is to bring intelligence into the global, medical supply chain. So we created some very proprietary technology. Jim and I and others, wrote about a dozen patents. A couple have already been issued, and it has one effect of it is that it effectively turns the internet into a global products catalog or database. And then our technology can automatically retrieve, optimize, and maintain that data. That then allows us to build this catalog, and we call it the UHMPC, the Universal Health and Medical Products Catalog. And the idea is that that'll just be a smart catalog and a comprehensive one. We want to have as much information about every single health and medical product in the world. We want to know where it was manufactured, how available it is, did the FDA approve it, what's the status, what's the pricing, so on and so forth. We currently have about 500,000 products in that catalog, and the catalog just grows constantly. We hope to have 1 million by the end of the year, 2 million by next year. Then the next thing is, okay, so we got this catalog and we can offer it to doctors and hospitals and surgery centers and consumers and the government. But now we need to manage that supply chain. And it was almost an unintended consequence of our original patents. We realized we could develop these digital agents to go to work in the internet to manage the supply chain for us. So rather than have an army of people tracking orders, submitting orders, updating availability and pricing, we have digital agents that just do it for us automatically. So the net result of this AI-powered supply chain system is we're highly scalable, and we have automated order capture, fulfillment, and management. Very few people, lots of digital agents.
Exactly. So I think this speaks to
Yeah,
this.
that speaks to this issue, and that is, that there's just not enough people. We're experiencing this right now in this weird economy. Like, are we in a recession? Are we going into a recession? But we're not really, because we got full employment. And it just has to do really with the fact that there's a major shortage of the workforce. Jim and I saw this years ago. Jim has a really interesting discussion. We did this in our tech talk here a couple of weeks ago. But in the end, there's too many computers and too much information and too much to do with those computers and not enough humans to do it. And that's really where AI overall comes into play. It allows the human to use an AI agent as an extension of that human to process either information or activities. So one way to think of ChatGPT that's sort of taking the world by storm right now, it's a very efficient way for a person to ask a computer, ChatGPT, a question and interact with that chat. And the chat has the ability to go back into billions of data points and intelligently answer that question or supply information or write a document or do whatever that may be. Information, massive information processing. So it allows one person via that chat to access billions of data points instantly. Well, we are similar but different. We have an AI agent, if you will, but rather than access information, and we do gather information and make this intelligent catalog, what we do is we leverage processes. So rather than, you talk to an agent and the chat gives you information, in our case, you interact with an agent via our platform, and the platform does things. And the things that it does, if you will, is that checks on availability, checks on a product, places an order, tracks the order. Again, allows an individual person to scale their activity by working through the iRemedy platform.
Exactly. So I know this question comes up too frequently. What makes iRemedy different from others? And I think it's interesting to just looking at the evolution of technology and companies. And so you might be able to speak to that a little bit on this slide.
Yeah, it's a little bit about where your DNA is, where you came from. And in the healthcare world, there are these massive medical supply distributors. And we work with them, and they're very good companies, and they're very important companies. They're a national asset, a national resource. So McKesson, Medline, Cardinal, many others, not many others, but a few others. These companies are massive. McKesson was, founded in the middle of 19th century. I think it was around the Civil War. Okay, Medline in the early 1900s, Cardinal in 1971. So these companies they have a DNA that goes all the way back to the, before the telephone, before TV, before automobiles, for crying out loud. That's just how they're built, and that's who they are, and they're important, and they're stable, and so forth. iRemedy is an ultra modern version of that. We were founded, based in a time when AI was maturing, and we're a tech-driven organization. So we just bring a modern, fresh, AI smart approach to the same problems that McKesson and Medline and others are attacking, but they're massive logistics company, massive logistics providers, and they have great services. And as I said, we use them and we partner with them. But we are different in the sense that we're all about information processing and scaling through digital agents and AI activity. That's what we're about. That's our DNA.
And explain the buying process. If somebody goes to iRemedy, what does that look like?
Yeah. Well, so, on the one hand, it's a little bit like e-commerce in the sense that you can go there, but you can access this massive catalog and you can find what you need. And that's pretty routine. You could do that at Amazon every day. But you can't do it at Amazon for healthcare, for medical supply, because Amazon doesn't manage the supply chain in a way that is acceptable to doctors and hospitals and surgery centers and so forth. We do, on the other hand. But then, very importantly, if the product you need is not available, our digital agents will essentially, they'll just go search the world and they'll look for that product until they find it. When they find it, they'll tell you about it. And then, you can then get it delivered to wherever you need it. So again, going back to this digital agent thing, this analyze idea, it has to do with this inherent complexity of med supply and contract pricing and in the analytics of that unfairness that I talked about earlier, where 100 doctors pay 100 different things for the same product. That has to do with these really complex GPO pricing schemes that are out there. Well, if you only had like 100 products, you could kind of manage your way through that. But these professionals, they have thousands, tens of thousands, sometimes 100,000 products, all with all these unique contract prices. It's just too complicated. So our system will analyze all that, and then it will execute the purchase, and then it will give you the reports that you need that you can use to assure that you got the right product at the right time at the best possible price, no matter how complex the problem was to get that product.
Precisely. So I think it's interesting to note we're approaching 15,000 customer ratings. That's pretty amazing, with 4.7 overall star rating. That's fantastic. We're the only web-facing, internet-facing marketplace with a catalog that the public can go to, that surgery centers can go to, so forth. We have a wide range of customers, a wide range of experiences. So in summary, and then I'm going to open this up for questions. I see a few people have already typed some in, and we'll go right to those. In the summaries, first, we believe that the UHMPC, that's the Universal Health and Medical Products Catalog, is the largest and smartest medical products catalog on the internet. We're going to continue to build that. So there's just massive opportunity. And by the way, there's a lot taking place regarding reshoring of medical supply manufacturing to either the US or North America or friendly countries. So we're very, very active in that space. Our technology marketplace AI system was developed by the creator of Amazon's marketplace. And Jim believes that this technology, this invention, surpasses anything that he's done before. Our executive team has had a track record of successful exits from acquisitions, as well as an IPO, the sale of our companies, so on. We had revenues exceeding 50 million in 2022, and we're in a big market. This is a $100 billion market, so it's just a massive, massive market. So I'm going to go into questions right now and see if we've got any questions that people have typed in. The question system here is always a little strange with GoToMeeting. So tell me about the $8.50 offering price. Is this based off of the $302 million valuation, or if I can get this, the current in process and past raise of roughly 44 million all in? I don't think we've done that level of capital all in. But Tony, just speak to the $8.50 offering price and where we're at vis-a-vis the valuation of the company and where we see that going in the future.
Yeah, well, I don't know what the 44 million all in is. We've actually raised about $10 million to get us to this place. The 850 price is just a valuation that we set working with our various bankers over the past year, I would guess. At one point, we did have an S1 filed, and we were looking at an IPO. We decided to pull it because we didn't feel like the stock market was in the right place. So we never really went all the way down that road. But we've just had a number of broker-dealer conversations that have got us to this point of this valuation. And we think it's very reasonable. We think we're going to grow as we continue to innovate and deliver this great technology, and then bring on new and more exciting revenue and contract opportunities. I think we've only just begun in terms of where this business is going to go. We are focused, on getting an exit in the next 12 to 24 months. I mean, we've never done anything but be candid about that. So we built a governance team and a corporate profile to be ready to either go through an acquisition, or a recap or an IPO, but something like that in the relatively near term. We think we're pretty mature and pretty ready to go.
Yeah, and I would add a couple of things to that. Number one, being a technology company and developing what we're developing is very, very, very important to the medical industry. We know this is the largest industry in the United States. It's a large market, so that can lead to some pretty attractive valuations. Interestingly, Tony was on a presentation earlier today with a group, and it was the Unicorn Group, talking about what makes iRemedy a unicorn, to drive towards that billion-dollar valuation. And we want to build a company that's capable of doing that. We're certainly in the right market. We certainly have the right technology. We've got the right people involved. So we're going to continue doing that. Another question came in. Tony says, does iRemedy warehouse and ship products? I see we're looking at our warehouse right here. Can you speak to that a little bit about products that we carry versus how we deliver products?
Yeah, absolutely. So first off, the majority, the vast majority, 80–90% of our business is what you would call drop ship or delivered directly from a manufacturer or distributor to our end customer. However, we do have certain circumstances where we are doing kind of little localized repackaging or warehousing. If we're supporting surgery centers in a small region, or we get a big government contract, we have product come into our warehouse, we reconfigure it and ship it right back out to the government, requires certain palletizing requirements. But the short answer is no. We have logistics partners and distributors who are more into the business of maintaining inventory. That's not our core business. We're going to be mainly a drop ship, business model.
Yes, exactly, because that becomes scalable. So we can go from 500,000 products in our catalog to 1 million to 2 million without physically merchandising. And by the way, there's other players coming into the space. I'm talking about the logistics side of it, the shipping side of it. So that will continue to improve and give more options of moving products literally around the country and around the world. Here's always an interesting question when I see this. Who are your competitors?
Yeah, we get to ask that question a lot. It's a tough one to answer. So, yeah, the answer really would be McKesson and Medline and Cardinal, who are, on the low end, 10 billion, I guess, and on the high end, $200 billion companies. But they're also people that we do business with. They're important partners of ours because what we do is different. We're online, we're digital, we're a way to aggregate that data and deliver it to the client very efficiently and effectively. We're a one-stop shop, for example. So we're different. And so in the niche that we're in, I always hate to say we don't really have a direct competitor because there probably is somebody doing something similar, but we're not aware of anybody, and certainly nobody's got our AI because our AI is patent protected, so that would be impossible. But just if you think of just pure medical supply distribution, that would be Medline and McKesson. Companies are 100 years old and doing 10 to 100 billion in sales.
Exactly. What's the main quality that differentiates iRemedy from anyone else out there? How would you describe that, Tony?
Yeah, well, we have a passion for disrupting the supply industry and using intelligence, to improve it. So that's why at our very core, our tagline is "Smarter Supply Saves Lives." We're on a mission to improve healthcare. It's a life and death mission. And the way we're doing that is bringing intelligence into the supply chain.
That was the last question we had. So thanks everybody for joining us. At the end of when you log off, you'll get a quick survey that'll come by you. If you have any questions that you would like to ask, please put them into the survey, and look forward to hearing from you. If you want any other information, respond to the survey as well. I'd be happy to reach out to you individually. So thank you very much for joining us for Thursday's call, and we look forward to speaking with you in the future. Tony, thanks very much. We'll talk to you soon.
All right, everybody, take care. See you. Bye-bye.